Dr. Daniel Pierre is a cataract surgeon at the Cleveland Eye Clinic. He's about to perform cataract surgery on his father, Ronald Pierre.
Which eye I'm having done? I'm having the right eye, which is also on the right side of my head.
Ronald already had one eye done, and this video will show you the surgery of his second eye.
Ready for round two.
Excellent.
And it's his birthday today, right?
Yeah, man, all you guys know, it's like one big happy family. It was amazing because he did my surgery on my birthday.
And now he's going to do your surgery on his birthday.
I
love it.
You have a birthday card for me?
I didn't want to remember it, so they were kind enough to put it on my chest.
You are really funny. I'm going to open it later though. That really means a lot, Dad. Thanks. Do you feel a lot different for this surgery than for the last one?
No, the same.
Really?
Yeah.
Well, didn't you feel a little bit nervous the first time?
None.
Not even a little bit?
None,
I think
honestly.
most people probably feel somewhat nervous though, right?
Yeah. No, I honestly didn't.
Okay. Well, knowing what you know now,
Yeah.
what would you say to somebody who was about to have their first eye surgery and was feeling nervous?
I'd say, just relax
What's the question?
and enjoy the ride.
A hand is the best. It's like better than anesthesia, he says.
Yeah. Oh, good. I know. I just let go of him, Darlene. I haven't.
Amanda, this is my dad, and you are stepping away.
Well, because you made me.
Just joking. Prepare for aura.
Ronald? Good morning. I'm good. How are you?
Good.
My name's Stacy. I'm going to get you checked in today.
Great.
What are we doing today?
We're doing my right eye.
You're doing your right eye.
Yeah.
Great. That's what we show.
Right.
Okay. I'm going to make two little marks here because this is your return visit.
Okay. I had a nice espresso, but I had it an hour before, nothing.
Okay. You didn't put anything in your espresso like cream, sugar?
Espresso. Now this guy wrinkled my shirt the last time.
I don't guarantee that we won't wrinkle your shirt. Just look straight up at the ceiling again for me. And again, this is the antibiotic.
All right, I'm going to give my mark to this eye as well. So this is the weird part. Just look,
What do you mean weird part?
or it's the where I draw on your eye. Look at my nose. Look right at my nose. Yeah.
Your nose?
Wow. That was horrible. I'm going to put some oxygen. Oh my
Down a little
goodness.
bit.
You know what? You hear crazy things like
Good.
that, but you never know
That's it.
anybody who this happens to.
What is that, a magic marker?
That is for me to put a little mark on the eye so that I can line up
There's
my,
really the absorption. Number one,
astigmatism correction.
Oh,
Just
okay.
exactly
Number
right.
two, the absorption.
So,
is
do
different.
you have any questions about this?
No, I'm just excited about getting this one. That first one was amazing.
Chew 'em, swallow 'em,
The only bad part of this, I'm not going to be able to compare anymore.
Yeah, that's right. The one good eye, the one bad eye, and the color difference, right? Do you remember anything at all from the last surgery?
I don't. I remember going in, and when you started, and that's it.
And it's kind of funny because we were chatting the entire time that you were out, that you were having.
No clue.
How about after the surgery? How was your experience there?
Wonderful.
Well, I remember you told me it was blurry for a day or two, but like it was clearing up sort of hour by hour.
Listen, it was so good. We stopped at Holiday Meats on the 30th. We got some Italian sausage, and the guy said, "Hey, you got some nice sunglasses there."
No, you actually broke the rules, Dad, because you're supposed to go right home and take a nap afterward.
Well, I did go right home.
All right. And you got the special lens, the multifocal lens, and that's been working out really well?
Yeah, the Panoptix.
Yeah, you've been seeing well at distance, and you've been digging through your reading glasses, which are not there
All the
because you don't
time.
need them. How about your intermediate vision? How's the screen? Like your
Perfect.
computer screen?
Yeah. That's probably the most reaction I get. Like this morning, I looked at a computer screen for the last time. I said, "Perfect, it's right here." And I closed that eye. I said, "Boy, it is blurry."
All right. Well, with the Lord's help, we'll have a similar result on this side.
Yeah.
I'm going to put in the multifocal lens for this one, and I'm also going to aim at your astigmatism to correct that as well.
Okay. And this is my dominant eye, correct?
This is your dominant eye, which I prefer to do second for a few different perfectionist reasons. So, yeah, this will be really good. It'll just be nice to have a matching pair now.
Yeah, well, it's neat because if that was not my dominant eye and it's so good, my dominant eye is going to be really dominant.
Probably really good
All right.
for you.
Any other questions before surgery?
None.
All right.
None.
Mind if I pray?
No, not at all.
Come to the doctor, just bring that
And keeping my mouth shut.
No, it's okay. You're allowed to talk. I'll tell you if I need you to. Now, remember when you had that episode of inflammation last summer?
Yes.
And it caused that little tiny bit of scarring with your iris?
Yes.
That's something a little bit more that I'm going to have to do this surgery. I'm going to have to sort of undo that scar for you.
You got the other lens handy?
Yeah, I've got a couple of lenses ready to go for you. During your surgery, I'm going to get one more set of measurements to help me perfectionistically pick exactly which lens that I want for you. 5 or a 20. We're going to use Aura for the right eye. And we're going multifocal. TM.
Okay.
Yep. You just sit and enjoy the ride.
Okay. I remember you said that the last time.
That's about all you remember, huh?
Yeah.
Hey, Dad, you know what's great? That little scar, the dilating drops just now busted it for me, so I don't even have to worry about it anymore.
What?
Never mind. All right, so first off, I'm going to do a little tiny bit of numbing medication. I'm going to put it right underneath the skin here, okay?
Okay, it feels like a pit.
Yeah, it'll feel a little pinch and a little bit of a burn.
Okay.
Well, I just made a little incision, and that's exactly 1 millimeter. And now what I'm doing is I'm putting numbing medication inside the eye. Now I'm putting...
You guys are the best.
Thanks. All right, now I'm just making my little incision here to get access to the eye. And now the part I'm doing is I'm opening up a capsule that holds your lens. This involves tearing a little tiny circle to give myself access to the lens. Alright, now I'm spinning your cataract around. I was just loosening up there with a little jet stream of salt water. I'm going to start taking the lens out. The part that I'm really interested in is if you can remember what it looks like when I put the new lens in.
Did he not remember last time?
No. Okay, I got your bulk of your cataract out.
Okay, and I am recording this in my indelible memory.
Okay, good.
There'll be a quiz at the end.
All right, we're going to prepare for Aura, if you please. You're doing great, Dad. I got all your cataract bits out. Now I'm just perfectionistically sort of cleaning up any crumbs that might be left over. For what it's worth, Dad, you're a whole lot better behaved this surgery than last time.
He was more talkative last time.
Yeah, red light this time.
Do
Do you see a little red light up there, Dad?
Yeah,
I need you to look right at that red light there.
in the middle.
Yeah, right in the middle.
There.
Right there, good.
Yeah.
Go ahead and
Higher.
capture. Perfect. So I'm just getting another set of measurements here.
I remember this a lot more because I am with
You want
it.
me to go up to this one?
Good. You might not remember it later. So we got TFAT 19.5 or a 20. This is asking for a 19. Let's do one more set of measurements just because I'm OCD.
Follow the press.
All right.
I remember this.
Yep. All right. Good. Go ahead and capture. This, for Dad here, I had 2 lenses picked out. I was like, well, I'll either use this one or this one. And so it gave me the tiebreaker. Good. So now I'm just getting the eye ready to accept the new lens.
Is that a
I have a
tomato down there?
19.5 T-fat, non-toric.
T-fat, non-toric, 19.5 it is.
Okay.
So what I was just measuring with that, it's a measuring laser. What it does is it looks at the curvature of the cornea, and it sends a grid of lasers in there to check the focus of the eye to help predict one more time just exactly which lens would be perfect for you. Now there's lots of ways to make measurements to predict the lens, and we do that before the surgery, but this just gives us one more chance to do it during the surgery once the cataract is out of the way. And perfectionists like me think that's pretty nice to have that tool available to us when we need it. So now, Dad, I'm putting the lens in. This is the part that I want you to remember because a lot of people tell me this is the prettiest part.
Good.
And if you could draw me a picture of it later, oh, that would be something.
I'm not talking a lot, right?
Nope.
Like the letter K or like a cave?
K.
Like you're seeing a light at the end of the tunnel?
Yeah.
Dad, don't follow the light.
How did you do?
He did great. He's a good patient. Good job, Dad. Thank you for letting me do that. I take that as the absolute
Now, I was
highest
just
compliment that you
responding
can
to
give
you,
me.
right?
Yeah, you did great.
I didn't talk about anything weird, right?
No.
Thank you.
How are you feeling right now?
Like $1 million.
Okay, good.
So you were a little bit better behaved this time. Do you remember anything still? You just told me 5 minutes ago. I still remember everything. I'm gonna hold it in my mind. I said, okay, good. Make sure you hold on to it.
And
All right. Well, I'll see you tomorrow. Okay.
okay.
Take it easy. Don't go to the store on your way home. You don't want
more
sausage?
Sweet man, too bad he's not coming back again, but you can come back and visit.
I'm just sorry I don't have 3 eyes.
Oh,
No, you guys did great.
All right. So how did your night go?
It was great.
Good. I mean, I called you on the phone, so I already know.
No, but it was great.
Okay, good. And your vision today is doing just about as expected. It's supposed to be a little bit blurry.
The first day as it was the first eye.
Oh, yeah?
No, I was, I didn't have any of that, I call it the shower effect.
Yeah, and it's funny because even though two eyeballs live in the same head, they can have a different experience in the healing process.
Yeah.
So sometimes the patient's first eye will be like 20/20 the next day, and then their second eye the next day is like 20/40, and they're like, oh no, should I be scared? It's like, no, it's okay. It's just every eye is a little bit different.
Huh.
So there's just a few things that I care about on the post-op day 1 visit. Number 1 is that we make sure that there's no infection and that your pain is under control. Okay, those are the most important things. Number 2, we know that the vision's supposed to be a little bit blurry at first, and just like you described the experience with your first eye, it's sort of like it gets clearer and clearer almost even by the hour, and it's okay if it's a little bit blurry at first.
Okay.
Yeah. Any other issues overnight that you had?
0.
Okay,
I
great.
even wore my little
Oh, you were a good boy and you wore your shield over your eye?
All this work.
Good. Yeah, so the reason why I have people wear a shield afterwards, like I told you, is if I do a perfect surgery, that's great, but your job is to keep it that way.
Yeah, I'm definitely.
So, and you're not cutting the grass, you're not sticking your face in the dirt, sand, mud, lake, or swimming pool.
No,
Okay, good.
No, we're good.
And no rubbing, because
That's
remember,
the hardest thing to remember,
Yeah.
is rubbing.
And if you
get a little itch and you want to rub.
Yeah, and if you don't trust yourself not to rub, then you can put your sunglasses on to just be a reminder, oh, I need to do that, because in order to rub that, you'd have to do 2 things, and you'll probably remember before you do that.
Especially those big jobbies.
Yeah, yeah. And then the shield at nighttime is just to make sure that the pillow doesn't sort of push into the eye and disrupt our perfect surgery.
Yep, you got it done.
Because the little incision that I make is like a little valve. There's no stitch in it. But if you push on the eye, it can it's sort of like pushing on the stem of a little tire valve there. So
Okay, and it just lets pressure
you
out.
don't want any fluid to get out or into the eye. You want it to be a nice sterile chamber where it doesn't let any bacteria into the eye.
Okay.
So,
Okay.
okay, well, without further ado, I'll take a quick peek at you.
Okay.
So I'm just going to take a look at the anatomy today and make sure that everything is healing up and looks quite all right. Okay. All right, so for Megan, who's taking notes for us, we got a clear corneal wound, side L negative. That means there's no leaks. And there's just 1 plus corneal edema adjacent to the wound's temporal. I've got my limbal relaxing incision along the 70-degree meridian times 2. Look down just a little tiny bit. And we have the multifocal IOL in place, PC intact. Good. All right, it looks absolutely exactly how it should. I'm just going to swing over and see the other eye again, the one that we
Okay.
did 2 weeks ago.
How's that baby look?
Still perfect. But it's nice to have a matching pair now, isn't it?
Oh, it's so, you know, I'm looking at the computer, the smallest stuff, and I'm looking here. I keep doing it, but before I kept closing one eye to see the difference. Now, they're like match set.
Excellent.
Did we get pork sausage or no?
Oh, yeah.
Yeah?
He stopped again. He broke the rules,
That's a
Dad.
routine.
He stopped at like the butcher shop after surgery.
Come on.
Okay. All right, I'll see you there. Love ya.